Flu season is fast approaching, as we know, and health officials say now's the time to get your flu vaccine. Brandi Giles, a nurse practitioner with Bon Secours, joining us live now, and we appreciate you being with us this afternoon, Brandi. So we're going to get right to it. A lot of information out there about why it is so important to get your flu shot this year. Why the push?
So the flu shot's always a good idea. It decreases your risk of getting the flu, as well as can decrease the symptoms if you actually do get the flu. Most important this year because a lot of the flu symptoms are the same as a lot of our COVID symptoms as well. So reducing the risk of having those symptoms, and then we know that you've had your flu shot, then your likelihood is lower of having the flu. But we also are not sure what the flu and COVID look like together. So we don't want to run into that either way.
Right. And if somebody does get sick and they aren't sure, again, if it's the flu or COVID, what should they do? Because as you just said, it's we don't know the difference.
Correct. So there are a couple of things, and it's dependent on the severity of your illness. So if you are at a high risk category, such as comorbidities like diabetes or COPD or something along those lines, a frail child or an elderly adult, then definitely 100% seek care. Otherwise, give your provider a call. Start with your PCP, family practitioner that you see, family physician's assistant, and talk with them about the best route for you, because they know you. If it's not at a time where you're able to do that, then definitely urgent, seek treatment at an urgent care. Just give them a call first, because we're trying to triage our illnesses and keeping those patients who have flu and COVID-like illnesses cohorted together in one center, so that we're able to conserve our supplies as gowns and masks and flu tests and COVID swabs and things like that, and keep those patients who are more infected that way. Other centers that we are treating other things like lacerations or sprains or minor fractures, things like that. So definitely give us before you come in and see us to kind of figure out the best route to take.
And what do you think about virtual visits versus in-person appointments? In the time we live in with COVID-19, do you recommend one over the other, or does it just depend on, your circumstances and maybe your symptoms?
It really depends on your level of comfort with that type of visit, with a telehealth visit, as well as, your pre-existing conditions, your severity of illness, what kind of symptoms you're having. There are some situations where you will need to, definitely have an in-person visit. If you're having, severe shortness of breath, then someone needs to see you and listen to your lungs. You may even need lab work. If it's minor symptoms, that could be, seen over a telehealth visit and then referred somewhere for testing if found needed. So it just depends on your level of comfort with that type of visit and what your provider thinks is best for your illness.
What do you recommend that point when you should make an appointment? Some of us try to put it off, like, hey, we're fine, we're going to fight this, or we're going to get through it. But what is that point of, all right, you need to get in and you need to see a doctor?
Not getting better. So viruses, we see COVID and we see flu, and they last about 5 to 7 days. But you at some point should start to improve. And if you're not improving, you only need underlying conditions, heart disease, or you are immunocompromised.
I think we're getting a little glitchy here at the end. Ooh. Oh, Brandi, okay. We're getting a little glitchy here at the end. Thank you so much for that advice. It's so important as flu season approaches, of course, so we appreciate your time this afternoon. Thank you.
Well, happening